Welcome, everyone. Thank you for joining us this afternoon for our 2025 Cohort Recruitment Q&A for the Champion Provider Fellowship. This is our agenda. We're going to this is the welcome. We're going to go over the Champion Provider Fellowship overview. Then we'll go to testimonials from Sonoma County. And then we'll go over the recruitment overview and then the application process. And then we'll have 30 minutes for Q&A. And at this moment, I want to introduce the team. I'll start off. I'm Nancy, the project manager for the fellowship. My role is managing the project coordination of the fellowship, which includes reporting, meeting, training and webinar coordination and logistics, partnership engagement, and coordinating outreach with fellows and LHDs. We can start left to right. Monet, are you ready to introduce yourself?
Yeah, my apologies. Monet Param Lee here. I'm with the California Department of Public Health, and I'm a liaison to the staff at UCSF and Brown Miller. Welcome.
And then Wakata.
Hi, everyone. My name is Lagata Semere. I'm an associate professor of medicine at UCSF and practicing primary care physician at our county hospital, San Francisco General. And I direct the Champion Provider Fellowship and have been with the fellowship since 2017 and in the director role for the past 4 years. So very excited to have you all here today to hear more about our recruitment.
Thank you. Mike, you want to go next?
Sure. Welcome, everybody. Mike Miller with Brown Miller Communication. We provide communication support and training to the fellows and work with the LHD to help coordinate and support the great work you guys are all doing.
And then Muriel.
Hi, everyone. I'm Muriel Banadas, and I work with Mike Miller. And my role here with the Champion Provider Fellowship is the day-to-day connection with the LHDs. And I'm here as your main point person.
And this is our team. Let's see. So next we'll go into an overview. I'll hand this over to Wakata.
So again, thank you all for joining us. I know some of you are familiar with the fellowship. You've had fellows in the program for years. And for some of you, this is a first introduction. And so really excited to have you here learning a bit more about what we do. So I'd like to provide a very high level overview of the Champion Provider Fellowship. And then we're going to spend some time diving into kind of what the benefits are, expectations, and really how this works between the partnership that we help coordinate between LHDs and healthcare providers. And I think one of the best ways to learn about the fellowship is to hear from fellows and LHDs. So you'll get a chance to do that, and we'll make sure to allow time for that. So really, the basis of the fellowship is that we start with community-based healthcare providers, physicians, and dentists, primarily working in federally qualified health centers, underserved communities, and they have a passion and interest in kind of thinking about more broadly social determinants of health and how they can play a role in preventing diabetes, obesity, dental disease as contributors. And where we step in from the UCSF side and working with Brown Miller and CDPH is providing individual training and technical assistance. So trying to help our providers and fellows that we select really think more broadly beyond the clinic walls and these one-on-one interventions about kind of the policy system and environmental changes that they can make to really enact changes in their community. And so one of the really key ways that we do this is through linkages with you. So connecting them with local health departments that are thinking about PSE changes all the time and want to partner with healthcare providers to bring this into the healthcare setting and can help them connect to community organizations that can further their goals in this capacity. And so we do a lot of web-based knowledge sharing and in-person skill building. And many of you have maybe seen that our website is where we store quite a few resources We host webinars and have trainings that we include. We have our PSE playbook that provides a roadmap for how to include these changes into their daily work and start to kind of think about interventions that they can enact. And we have in-person skill building, whether it's through media training, persuasive narrative training, our mini college, where we kind of walk through introducing the concepts of PSE and what it truly means, and all of the different ways that they can think about PSE more broadly and do some action planning around changes and interventions. And over the course of this kind of windy road over 2 years, we hope to develop engaged and excited providers that want to champion community change and now have the resources to do that. And we hope that we plant the seeds for that change to take place over years to come, and that they're supporting fellows behind them. And I think we've truly seen examples of that, where fellows from different cohorts are kind of carrying and passing the torch and continuing the work that we do. And we always find that really exciting. So, just to highlight the key partners in the success of the fellowship, one, we talked about our passionate healthcare providers, and that's where you come in, helping us recruit those community providers, the physicians and dentists that are excited about this work, and we can help develop the tools that they need to carry it forward. Of course, CalFresh Healthy Living Program and the Office of Oral Health that provide tremendous statewide support to make this program possible, and UCSF that provides technical assistance on our side and coordination of activities. And then, of course, our local health department collaboration. And I'll mention BMC that's here that you've heard from that are also supporting all of our efforts in tremendous ways. So we've trained many physicians and dentists over the years and have been really excited to be able to say that we have had fellows in 31 counties over the years throughout California. Our first cohort, the kind of pilot group, was onboarded in 2014. And since then, we've been going strong. And this year, we are celebrating 10 years of the Champion Provider Fellowship, and we'll be onboarding our sixth cohort, and are looking forward to them joining our 103 doctors and 28 dentists. And I'll say that number of dentists has been steadily rising, and that's been great to see.
Thanks, Wagata. So now I'll turn it over to our Sonoma County team. We have Laurel Chambers with Sonoma County LHD, Ariel Thomas Ehrlich with the Sonoma County LHD, and also Dr. David Tai, who is our current fellow for Sonoma County. Thank you, everybody, for having us. We're excited to talk with you about our experiences. We'll start here at the health department, and then we'll, I believe, turn it over to Dr. Tai to talk about his experience. So you can see here the logos from all of the programs that have been engaged in this process. My colleague called this logo soup, which just talks about the great collaboration across many different programs. I think just highlighting that. So if we could go to the next slide. So wanted to start by introducing ourselves, those from the health department that are here today, and then also just highlighting those partnerships who maybe aren't here with us today or were with us for a period of time, but want to highlight their contribution. So my name is Ariel Thomas Ehrlich, pronouns she, her, and I'm with the local oral health project. We also have partnerships with our childhood-led prevention program. And we had a UCSF dental public health resident for the 2023-2024 school year who participated in this program as well. And my colleague, Laurel, is here to introduce herself and what program she is with.
Hi, everyone. I'm Laurel Chambers. I am the project director for the CalFresh Healthy Living program here in Sonoma County. I'm with the LHD. And next slide. So for our project, we decided to focus on drinking water on water consumption because it was a nice a crossover issue that affects both dental health and overall health. It's something that CalFresh Healthy Living is fully behind, and also the dental health program could focus on as well. And so the focus was to understand tap water perceptions and drinking water behavior in Guerneville, California, which is where Dr. Tai is based. And he came into the program with observations and anecdotes around water consumption and water biases in the community. And so we wanted to take a look at that. And our resident from UCSF, Lauren, developed a survey that we conducted this past spring, and that yielded a lot of really great information. And we are currently working towards the installation of water bottle refilling stations and water fountains in strategic places around the county to benefit the general population and especially to benefit the unhoused population, which are at the highest risk of not having access to clean drinking water. Next slide.
All right. Thanks, Laurel. So we wanted to talk about some of the overarching benefits, costs, and time commitments that a local health department might expect. Laurel and I both agreed these were pretty unanimous across both of our programs, so we combined these. So first, some of the benefits. We have found that we've been able to partner with both our champion provider as well as the organization that he represents. We've been able to learn a lot about what's going on in the community, understand the work going on, and also able to create those strategic partnerships. And then it's also resulted in direct action and advocacy around a variety of other PSE strategies that may be tangentially related, but also some direct relation. So, of course, important is the financial costs. I know many local health departments wonder what's it going to cost to get involved in this program. So the cost is pretty minimal. The only cost is related to the travel to the mini college. And while we are so excited to be partnering with our Southern California folks, we were the only Northern California location this year, which meant that our costs were probably higher, both in time and in financial costs, than those in Southern California, given that we had farther to travel. So we had an estimated cost of about a little over $1,000. That included our hotel, airfare, mileage, meals, and registration for the mini college. And then it took about a day and a half worth of staff time, both including travel as well as the time within the mini college. So that probably is on the higher side of the financial costs if you're considering thinking about that. And then look for local oral health departments. And Laurel, please correct me if I'm wrong, but also my understanding for CalFresh is we were able to incorporate this within our budgets. That was not a concern. I'm seeing Laurel nod. So we were able to incorporate that within our budgets without any concern from our funder.
You do want to add it to your budget as soon as possible, though, so that it can get approved by all of the levels that need to approve it, though. That's the only thing.
Yes. Thanks, Laurel. And the final bit is the time commitment. So we, on a general basis, have monthly check-in meetings between our champion provider and the local oral health department. We also have quarterly local health department meetings hosted by Nancy and Muriel here. This is actually one of the normal days we might have one of those quarterly meetings.
Yeah.
Okay. This is an opportunity for local oral health departments to connect, share experiences, challenges, and successes. And then finally, there is some sharing of information and resources between meetings. Those look like emails, general kind of quick communication. So next slide. We're going to go in a little bit into both the oral health as well as following up with CalFresh on how we can connect it to our work plans. So this is a summary of how we have reported on the work that we've done with our champion provider within our work plan. I do want to put the caveat here that Sonoma County did not select all of the optional additional objectives, namely objective 5 and 6. So it may be possible that we could have reported it there, but I don't have that objective in our work plan. So I couldn't report on that. But we are able to report this work in objective 4.2 around sugar sweetened beverage reduction, things like rethink your drink, connection, objective 1.1, establishing relationships with stakeholders, and 1.2 with our needs assessment. We've learned more about the services and gaps, which has only benefited our ability to write the most comprehensive needs assessment that best outlines what we want to work on within Sonoma County. So next slide.
And this is my slide from my CalFresh Healthy Living IWP integrated work plan, in other words. And as you can see, it's fairly brief. There's not a lot in my work plan around the Champion Provider program, and that's because I put together the work plan before we had done the survey and before we had fully fleshed out the program. And so the next time I go in and update my IWP, I will be adding more details and that this was enough to get it approved and enough to go on initially. Obviously, depending on what project is chosen, that will determine which settings you choose to write it into. But I just wanted to provide the actual text of what our Champion Provider program looks like in our IWP. And another thing that I wanted to mention too about the benefits of the Champion Provider program specifically for local health departments is that the Champion Provider program is a great way of educating local elected officials and decision makers. It will often come up as a natural part of the project. For example, Dr. Tai has reached out to the board of supervisor that covers Guerneville and has educated her on our survey and what we're finding. And that is something that you can report, especially if you were involved in that outreach and that education. And then I just also wanted to say too that I will be reporting on this work in pairs as a PSE strategy. So that's another benefit as well.
So thank you for allowing us to share our experiences. I know Dr. Chow will be adding. If anyone has questions for us from the local health department perspective, either of our programs, or just more generally, happy to answer any questions during the Q&A portion or offline individually, if that would be helpful.
Alrighty. So I'm David Tai. I'm the dental director out in West County Health Centers. And I became a UCSF Champion Fellow about a year and a half ago and applied for this program and really had no expectations. But it was recommended to me by my CEO to give this a try by Jason Cunningham. And what this has unfolded has been so invaluable in my professional career in the sense that it has allowed me to work with so many partners of our community, has allowed me to really understand what it means to tackle chronic disease burden from a public health perspective and how to see things from the patient's point of view. And so the Champion Provider Fellowship Program is invaluable because of just all the trainings that were provided on how to work with one another, how to create our messaging, and how to build relations. We had, at our fingertips, just access to a public relations team, which was very invaluable in teaching me how to communicate to everyone came in contact with. And really allowed me to address an issue that I didn't even know would be an issue for my community. As dentists, we're trained to work on such a minute level. I never really looked at everything from a macroscopic level. And this allowed me to have the humility to see from my patient's point of view that even though I recommend them to drink something else aside from a sugary beverage, that even water might not be the alternative that they have access to or trust. And so with working with our local health department and the UCSF Champions Group, we've been able to come a very long way with learning how to get funding, knowing the right partners to work, and how to make installing filtered water stations in our community a reality. And, that's going to have so much impact on our community to reduce chronic disease burden from dental decay, diabetes, heart disease. If we can just include beverage um, as um, as a factor in just being healthy and restoring that trust in our community to drink water again. And so, if I had to pick my team all over again, I would pick the exact same team. Um, I would pick Laurel, Ariel, Lisa, and Andrea, and Lauren Gritzer all over again. We're going to have a better team to work with, and really just taught me a lot about what's how to make something happen in our community that will be in the best interest for my community. So I cannot speak enough positive things about this fellowship program, and yeah, look forward to answering any questions anybody has, and thought this was a wonderful experience.
Thank you, Dr. Ty, Ariel, and Laurel for the wonderful testimony. I'm sure you'll get many questions in the Q&A. So let's move on. The recruitment overview. So Muriel will take this slide.
I think she handed that off to me, Nancy, so I'll take it. Yeah, we wanted to talk a little bit. You heard Ariel and Laurel talk about this. I wanted to just accentuate some of the benefits that should help the LHDs, all of you, as you're looking and considering this program. It's no surprise, actually, when you consider these benefits, why so many of the counties are repeat offenders, if you will, that are constantly coming back to the well to get more champions. One of the things that you should expect is the LHDs are respected advocates for change. When you have somebody in a white coat, either a physician or a dentist, they automatically have a certain level of respect with the public, and they become very powerful advocates for several reasons. One, because of their technical knowledge, but also because of the experiences they're seeing in their office that they're able to elevate and put in front of people. It brings a real passion to the issues that you're addressing as well. When you're looking at PSE issues, to have a doctor or a dentist who can speak to these issues. At the same time, one of the things that the program was designed to allow is all of the fellows are volunteers. They're unpaid, and as a result, they're unrestricted. So where you may not be able to speak with policymakers, you may not be able to call for a policy change, they absolutely can. They can call things out. They can move things forward. It's one of the real assets of the program, and having a champion that you're able to work with. The other thing is, we'd like to believe that Muriel and I have worked and trained the champions not to become compelling storytellers, because I think they are in and of themselves, but helping them to see what it means to be a compelling storyteller, helping them to find those stories that tie back to what they see every day in their practice, and to elevate those. So often, when we're dealing with doctors and dentists, they want to speak from a very technical perspective. We help them explode that into a much more emotional perspective as well, because that's where people are really they shift. They need both the data and the information, but they also need to understand that this matters and to hear it from somebody's perspective. So being compelling storytellers is something that I think you'll really find if you're lucky enough to get to work with a champion provider. And then finally, they also have a unique understanding of the healthcare delivery system. That allows them to speak with their colleagues, that it allows them to speak with others, and it helps them when they're speaking with policymakers to explain what the system is and how the system operates, from a very personal experience, and moving all that forward. So when I think about the LHD benefit, I think if you have an opportunity to work with one of the fellows, I think you're going to find that they are really going to elevate your PSE work. They're the that link you may be looking for somebody who has talent, who has respect, who has passion, and who has living experiences to help elevate those issues, those PFD issues for you amongst many different audiences.
Thank you, Mike. Then here are some of the fellow benefits as you will be speaking with potential applicants for the fellowship. They include free CME CDE certified trainings. They get access to interactive webinars. Also, they get personalized consultation and technical assistance and facilitated connections with LHDs and CPOs. They also gain access to the fellowship's alumni network. And some expectation for fellows, they're required to attend the onboarding. They're strongly encouraged to attend the mini college, as well as strongly encouraged to attend the communication trainings that we offer once a year. They are required to author a blog and engage with their LHDs in a PSE project over the course of the fellowship and to complete quarterly activity reports. And then Muriel.
Yes, and so thank you for that. So with regards to the Champion Provider Fellowship, so what are the expectations for LHDs? We hope that we could participate in our in-person onboarding, which is also called the mini college. We try to accommodate for Northern California and Southern California. So we are going to be thinking through in terms of like where the locations are going to be given to Arrow's point in terms of your financial requirements. We do try to accommodate for either Northern California and Southern California, so we may split them up. Um, the We would also hope that there would be some collaboration with the oral health and the CalFresh Healthy Living. Very similar to what we just showed you with Sonoma County, that collaboration is really key to moving PSE projects together. This is where the budgets, this is where the projects, this is where it all lives. And so that collaboration is really important. We also would like for you to regularly meet with the fellows. I believe that most of the counties are meeting with their fellows once a month, if that works for them. I know that might be a heavy lift, but the fellows also find that the regular meetings are helpful for them to remind them of what they're tasked to do. And then we have their quarterly LHD meetings. This is where we get together. We have a get together to update everyone on their projects and if there are any challenges that they have faced, and if anyone has any recommendations on how to move forward. And this is kind of like a conversation. We learn and we reach out for these types of challenges that we do end up, facing along the way, because it's a process. And then the role of the LHD to the champion provider when you are recruiting. So when you have the fellows, we would like for you to identify potential providers or dentists in your county and promote this opportunity. What's important is we need for you to gain the health officer's support. I believe this was Mike remind me on this one, but this was key to garnering the support and moving things forward. We found that in the past, having the health officer support this project um, stopped a little bit of the progress that you may have started.
Yeah, I think to a large extent, it was also just health officers weren't familiar with the project. When they became familiar with it and signed off on it, then they became very curious, and we saw a much higher level of support throughout it, support for your work as an LHD, and a higher level of interest in what was going on. So I think that as an outcome of that, we made that a requirement to get a sign off from your health officer.
Thanks, Mike. And then when you have an applicant, it's important that you speak with them prior to submitting any type of application to on our end. Get to know them a little bit and see if any of your if what they're interested in will fit with your projects and scope of work. The application and materials, you can find them online on the championprovider.ucsf.edu. And then the deadline to submit is Friday, December 13th at 5 p.m.
Thank you, Mike and Muriel. I'll go over the fellowship application process. So the application process is a two-part process. There's one application for the clinician and then also one application for the LHD. For the clinician, they're required to complete an online application, get an employer letter of support. It's important that their employer knows that they will be taking some time from work to work on their PSC projects and to also attend trainings from the fellowship, as well as having a brief call with the identified LHD liaison. For the LHD, you're required to complete an online application, get a letter of support from your local health officer, and to ensure your chamber provider fellow applicant has submitted their completed application. Also, prior to submitting the application, make sure your county has a primary contact for the fellowship, identified a healthcare provider. In the application, you'll be able to, if you get more than one applicant, to rank your choice for your fellows. And to also please review the fellowship expectations document that's posted on our website.
Okay, so we want to talk a little bit about the conversation that Muriel mentioned that we want to encourage you to have. I think the thing that's really important to understand about this program is it succeeds when there's a good, strong partnership between your office and the fellow. What's shared in common is the passion for improving the community, and most of these providers are really looking for ways of elevating their things beyond what they do in clinic, to really making a difference so that they're improving the health of the community, and putting prevention out there so they don't have to do as much work inside the clinic. We're really encouraging you to initiate the contact. Once you have a fellow who is ready to move forward, we'll want you to initiate the contact, give them a call, see if you can set up either a phone call or a meeting. A meeting would be ideal. They're very appreciative of the depth of resources that you bring to all of this, your contacts, how your program operates, the materials. Those are gold to a lot of these fellows who are like, wow, we had no idea how much was there. So let them know, introduce them to it, because that's really where they're going to find out how they can tap into all of that. Then you want to discuss with them your PSE focus, and what kind of things you're doing around your PSEs. This is where they're going to start to, you have to understand they're coming into this, and many of them, we're introducing them for the first time to PSEs. So they don't necessarily understand it, but they definitely want to make sustainable long-term community change. And when they hear about PSEs, they get very excited. What we're hoping is that there's a melding between what you're doing and what their passion is, so that you both can elevate that PSE work forward. But you'll also, I mean, this is a relationship, so it's really important to listen to the interests of your applicants as well. What is it that they care about? What is it that they'd like to see? So looking for that fit becomes very important. Trying to find a way to make it all come together. And I got to tell you, answering questions is huge. It's a little intimidating once you've gone through the entire application process. If you've been selected to be a fellow, I think most of the fellows feel like, oh my gosh, what have I got myself into? They're really looking for this partner who can help guide them, give them some direction, answer their questions, to move all this forward. And then ultimately, we really want you to, as Muriel said earlier, most of our applicants come from you, right? You knowing your community, knowing somebody who you think might be a good fit for something like this. So your recommendation of applicants is really critical. This is where we found the right people, and usually it means that there's already some kind of a relationship and marriage. So those become the important elements as you have a conversation with your applicant.
Thank you. So now for the selection process, when we're looking for applicants who have a passion for creating healthier communities, those who are committed to advancing PSC change. We're also looking for diversity in the applicant pool, which includes language, population served, their medical specialty, and geography. And they must be able to participate in the onboarding in June 2025. Here is the timeline for the application process for this cohort. Today is the Q&A webinar. The application opens October 1st, 2024, and will close December 13th, 2024 at 5 p.m. We'll announce the new cohort in February 2025, and then the onboarding training is in June 2025. So now we'll take some time uh, to do some polls. We activate these, and then I'll launch them, and then we'll share the results. So it looks like many of you are interested in the fellowship, participating. So let's go to the next poll. So here we have a mixed results of the likelihood of nominating fellow. And let's go to our next question. Do we see the next question?
Yeah. Okay, so it looks like some of the challenges are lack of staff support, time, budget. We can address some of this during the Q&A. Let's go to our last poll question. So it looks like there are folks who would like a follow-up call. We will go through those of you who selected yes for this, and we'll reach out to you to set up a meeting. Thank you for participating in the polls. Now we will get into the Q&A. I see two questions already in our chat box. One is from Catherine in San Diego. I became one of the
San Diego liaisons, we were already approved for the current cohort, do we need to submit an application for each cohort cycle? That would be yes, because the LHD would need to recommend an applicant, and also rank if you get more than one applicant, as well as talking about your PSE work, and that might change from time to time. And then next question from Sherry: do fellows get any paid financial support? Unfortunately, they don't get any financial support from the fellowship.
If I can
But they
point in on
do.
that, Nancy, I think it's important that they don't get any financial support, and there's a reason for it. One, we're looking for people with real passion, who are really committed to trying to improve their community, and so that's first. Secondly, if they got financial support, then they're more limited in how freely they can speak. If they're receiving money from a government entity, there may be more limitations, and so it's kind of nice not to have that restriction. Unfortunately, yeah, it'd be great if we could pay these folks, but because they are doing an amazing amount of work, but it's a passion that I think really drives most of them forward.
And we do cover the costs of attending the training. So all of the travel to attend our trainings, the media trainings, the persuasive narrative series workshop, the onboarding, the mini college. We cover those costs.
Ariel, you had your hand raised.
Yeah, that was just what I was going to add is that for fellows, there's that financial support for the trainings.
So if you have questions, please put it in the chat box or raise your hand and you can unmute yourself and ask your question.
Yeah, I mean, I can add on to that, responding to that question as well. I mean, to me, when I joined this program, it was about value. And I knew that I was going to become a better leader. I knew that I was getting media training. I knew that I was developing partnerships. I knew that I was getting different opportunities through the networking that I was in. And even with my networking, I was able to acquire a grant that I wouldn't have otherwise. And that grant ended up becoming $350,000 for my clinic. And so there's things that may not be direct, but there are indirect things that that does come out of this program.
Thank you, David.
Dr. Another question came in. Will the fellows receive reimbursement for meals? This was the first year meals were not reimbursed. So for the trainings, we do provide food.
Yeah,
For
this
the
was the
fellows.
first year we provided food. So I don't think we've ever reimbursed for meals. We previously were not able to provide food during the trainings, but we have been able to incorporate that since it's part of the training, and we incorporate the meals into networking and during the training. So given some of the policy changes and updates through CalFresh, we've been able to provide that.
Well, it's a question that came up for Sonoma County. How were water stations funded?
We're currently in that process right now, actually. And we're finalizing some potential funding sources. One partner we didn't add to our slides because they are a very new partner is Zero Waste Sonoma, or waste management partner, and they may have some funding available. There's also grants that are potentially a competitive grant process that we're looking into, which is around beverage containers. So while this project is focused on health and focused on addressing dental disease and obesity prevention, it also helps reduce single-use plastics, which is of great interest to some of our waste management partners. So really an opportunity to bring in a lot of different folks. So I'm hopeful that by the next quarterly meeting, we'll be able to more definitively answer that question on where the funding is exactly coming from. There are a couple funding sources we're exploring.
Right. Thanks, Ariel. And then another question: do we only need to recruit one fellow, or can more than one be recruited? Yes, there are counties with one fellow, but there are other counties with two fellows. Sonoma County does have two fellows. Dr. Tai is one of them, and I saw in the chat, San Diego also has two. They have a dentist and a physician.
Yeah, so it's not atypical that some counties, like LA County, a very large county, often has multiple, as many as three sometimes. Uh, what we're really looking for is the right match with the right LHD, and somebody who really understands and has the passion for making that change. But um, we'd love the challenge is to disperse our fellows as broadly as possible. That's one of the things that we really like to do. And knowing that, every county has special needs, trying to match up to that.
And I think also I'll just briefly add the resources. So we want to make sure that you have the resources to support multiple fellows. So we do ask you to rank the fellows to help us determine who feels like the best match. But we may say, all two of these fellows, and on, a few rare occasions, three will be kind of admitted to the program. But we have an ongoing conversation with you to make sure that you feel that's something you can support, and that it would work well.
Your next question is, any nonprofit hospital community benefit partners interested in funding?
Water station.
Oh, water station. Laurel, do you want to talk about some previous work?
Yeah. So, we, a while back, I think it was several funding cycles ago. I think it was back in 2016, 2017. We have had funding from Kaiser, that we had one of their HEAL grants, and that was less restrictive funding, and so we were able to use that funding to install a few community water stations. This time around, we haven't gone that route, not yet anyway. The Kaiser funding has moved into different priorities, and we haven't heard of any other um, hospitals that are looking to fund this kind of work, but that's a great suggestion.
Yes, there are two applications for the fellowship, one for the LHD and one for the fellow.
Maybe in the last couple of minutes, if there are any other questions, feel free to chime in, but we can go back to some of the barriers that folks mentioned uh, to participating in the fellowship, since we saw a bit of that mismatch, which we often see where there's some enthusiasm, but then we have uh, challenges actually identifying providers and engaging in the fellowship. So, Nancy, if you want to go back to that poll question, maybe we can see if there are any that we can further address for you guys.
I knew that probably the largest, the final response, difficulty identifying a physician or dentist, is atypical. And that is always challenging. You may not have as many opportunities to interact with physicians and dentists, so you may not know where to go. We have found great success. If you've had a former fellow, they often are great at recruiting and bringing in other people as well. You could also go to your local dental association or your local medical association and talk with them, see if they've got any interest. Morgana, I don't know if you have other thoughts there, because I know
Yeah,
that
it's a tough one, and we find that it's our biggest barrier every recruitment cycle. And yes, I would say those are great strategies. We do rely heavily, and we've brought some great fellows in based on word of mouth from prior fellows. And I would say, if you have not already, please speak to your current fellows about helping with that recruitment process. They're really great at identifying people who would be a good match. We also do send out broad blasts to local societies and other organizations. And so we may reach out to you if we hear back, or there may be providers that are in your county that express interest. That's not always the biggest source of recruitment, but if it happens, we're certainly, want to be able to help build that connection for you if we hear from somebody locally through one of those recruitment advertisement reach outs that we do. But yeah, dental societies are a big one, I would say. and then kind of the current fellows really helping them, having them help you recruit.
I think the remark on lack of staff support is a very valid concern. Honestly, what we don't want to do is put a fellow in your county that can't be supported. This is really truly about a partnership, and it moves and elevates very quickly. I think you can talk with some of some of your LHD colleagues who've had fellows who will tell you that it may not be as much time as you think, although suddenly the LHCs get very excited about the work that their fellows are doing. And they may put more time there than they thought, but it's surely out of an excitement level that they're seeing things happen that they may not have been able to make happen without a fellow. So I get the lack of time, the lack of support. It's certainly understandable, and it's something you should take into consideration. But I would tell you that, um, at least from what I've talked to with other LHCs, this is exciting work. It takes you into a different territory you may not have been in before, and you get to do things that fellows come in with a lot of creativity and a lot of different approaches and do things that are really a big difference, and it becomes an exciting place to be working, and usually does reflect back on your scope of work. It's not too hard to make it fit your scope of work. So. As far as lack of budget, eh, there's, I think, Ariel and Laurel showed what their costs were. Ariel showed her costs. There's not a lot of a cost involved here. It's not, this isn't going to draw heavily from your budget. It may draw down from time, but probably not from financial budget issues. There's the one travel. If you can't make the travel, the LHD should be able to build it into, their budget, but for dental health, that more that isn't there. Um, but if that's holding you back, I think we should talk about this because really there shouldn't be a big expense involved in any of that financial cost.
We do have a couple of questions on the on here. Nancy, do you want to address them about the Q&A session for providers? I think, or how we manage that if providers are interested. And then maybe Laurel can address how you nominate in terms of the fellows for CalFresh.
For that, well, I can, Nancy, so that we don't have a Q&A session for providers, but please refer any providers directly to us, and we're happy to speak with them on a one-on-one basis about the program. We would be excited to do that. So definitely provide them with the UCSF champion provider email address, or Nancy, and then just get in touch with us.
And then for the other question, what fellows can CalFresh nominate? We've seen counties where CalFresh directly nominate MD, and they work with the rural health office to nominate for the dentist.
Although CalFresh can nominate a dentist as well, right?
Yeah.
No restriction there. So
Yeah, there's no restriction. They just have, we encourage them working with the oral health office.
Exactly.
Just trying to make it clear that if you knew of a dentist and your CalFresh, there's no problem nominating them. The best thing to do is to reach out to your oral health program and team up on that.
And we have MDs who are pediatricians, family medicine, internal medicine, typically in the primary care fields, but any sort of MD.
You guys will be sending a follow-up email?
Yeah, for everyone who selected yes for a follow-up meeting, we will be sending an email to set up a meeting with you. And we will also be sending this copies of this PowerPoint slide.
Can I also this isn't a Q&A, but I just want to toss this in here. If you're interested in moving forward with a fellow, getting started early is really important. It makes your life a lot easier. It means that we can provide you with the support you need in either hunting for, talking about, answering questions, helping you with the application process. I know that if you're like me, you may procrastinate and wait till the last minute. There's steps in here that do take some time, and it's really great to get started on this early. It's great to have a conversation with somebody who's interested, and find out if it feels like it's a good marriage between the two of you. So and that would be my parting shot here is we deliberately are having this session earlier than we usually do because we want to give you plenty of time to start thinking about who might be good, what would really serve my community, what would help me be more successful in the work that I'm doing. What kind of fellow would I like to have?
I look forward to a follow-up meeting. I missed a lot because we have a deadline of moving offices, but I would really like to follow up with somebody one-on-one to get the information I missed because it sounds like something I would be interested in doing for Mendocino County.
Fantastic, Jennifer.
Great, Jennifer. So the email here is my email right here, Muriel@brownmillerpr.com. I will be the contact if you have any questions. If you have any questions about the process, Nancy and I will work with you, but I wanted to give out my email address so that you can go ahead and email me with any questions or anything that you run into during this recruitment process.
Yes. And this webinar was recorded. We'll be posting it on our website. You can find it on championprovider.ucsf.edu. We're posted by next Wednesday. I'll also send the link to it to everyone who registered, so it'll be easier for you to find.
Right.
If there are no other questions, you can still email us and we can respond back to you either to championprovider@ucs.edu or reaching out to Mario@brownmillerpr.com. Thank you everyone for attending and for your interest and excitement. Thank you, Sonoma County, for taking your time.
Yes.
Thank you, David Ty, for taking time from your clinic day to do this testimony for us.
Thanks, everybody.